Hello, everyone, and welcome to our webinar, Disadvantaged, How Medicare Advantage Plans Fail Us and Would Sabotage Medicare for All. My name is Linda Peterson, and I'm going to be the moderator tonight. I'm a board member of Puget Sound Advocates for Retirement Action, or PSARA, which is sponsoring this webinar. We in PSARA believe that healthcare is a human right for all people, not just retirees. As the COVID-19 pandemic rages on, the need for national universal health care has become painfully apparent and urgent. Ideas for healthcare reform range from a fully public single-payer system, such as a new and improved Medicare for All, as proposed by Representative Jayapal and Senator Sanders, to simply advocating for the inclusion of a public option in a hybrid system that would still be dominated by private insurance. Are there lessons we can learn from our current Medicare system? After all, it already offers people a choice between a public option and a private option. Traditional Medicare would be the public option, and Medicare Advantage would be the private option. Without stealing too much thunder from our panelists, who I'll introduce in a minute, let me briefly explain. Traditional Medicare, some of you might know it as Parts A and B, is the public option because the federal government pays for all services directly on a fee-for-service basis, without any insurance company coming between you and your provider to call the shots. Now, I know most people on traditional Medicare also get Medigap or supplemental drug coverage because Medicare doesn't pay for everything, but neither do Medicare Advantage plans. Medicare Advantage is the private insurance option. Medicare Advantage plans are offered by for-profit companies mostly, like United or Aetna, though here on the West Coast, Kaiser Permanente, a nonprofit, also offers one. The insurance companies offering Medicare Advantage plans get paid a flat fee from the government to cover the care you need or that they think you need. To state the obvious here, since they get a flat fee, they make money when their members use less care. Medicare Advantage plans can be attractive to Medicare recipients because they can offer some benefits not covered under traditional Medicare, such as discounted eye exams, discounts on certain drugs, or gym memberships. But Medicare Advantage plans are then also in a position to set a lot of rules and dictate the terms of your coverage, from requiring use of their in-network doctors, requiring prior authorizations for treatments, or even denying coverage. Private insurance companies have been aggressively marketing their Medicare Advantage plans. If you watch TV, you know the airwaves are inundated with Medicare Advantage plans. And retirees have been increasingly opting for them over traditional Medicare, especially when they first start out and they're relatively young and healthy, and that gym membership sounds good. What can we learn from our nation's experience with these private insurance Medicare Advantage plans? And what might it portend for our hopes for a new and improved Medicare for all? Before I introduce our speakers who will be exploring this issue, I want to note that this is an interactive webinar for those of you who registered via a Zoom link. We're going to have an instant poll question for you in a minute, and you'll have an opportunity to ask questions of our speakers at the end. For those of you watching a live stream on Facebook, I'm sorry you will not have the same opportunity, though you'll be able to see the poll results and listen to the questions and answers. Now, I know we have an audience made up of people of a lot of different ages on this webinar, but this instant poll question that we're going to post here in a minute is only for those of you already on Medicare. Are you on traditional Medicare or a Medicare Advantage plan? So if we could have that instant post or that instant poll come up, go ahead and click where you are, whether you're on a traditional plan or a Medicare Advantage plan. And then we'll get the results in just a minute. Are we getting any results yet?
We have 82% have voted. It is 55% traditional Medicare, 43% Medicare Advantage.
55% traditional, 43 Medicare Advantage. Okay.
Correct.
Can we show that on the screen or not? Okay.
It's a little small. People should, yeah.
Okay. Well, just let me mention that nationwide, slightly under 40% of retirees on Medicare are on Medicare Advantage plans. That number has been going up every year because it seems to be attractive to some people. We can take it down now. Thank you. And now I would like to, oh, there we go. There's the result right there. Okay. Yes. That's a little bit more on Medicare Advantage plans who are watching this video, which is probably understandable given the title of the webinar. Now, I would like to introduce you to our three speakers who have been waiting patiently. Each one of these speakers is a leader in the field of healthcare policy and reform, and they have studied the role of private insurance companies and have formed strong opinions on the way forward. Wendell Potter, who is joining us in a car in Tennessee somewhere, is best known as a health insurance whistleblower. He worked as an executive in the corporate health insurance industry for many years and knows the problems firsthand. He is now the president of the Center for Health and Democracy, which works to transform our system of health coverage from one driven by private industry profits to one driven by the needs and rights of every one of us to get the quality health care that we need without impoverishing ourselves. Diane Archer has spent her entire career helping people get health care that they need and advocating for guaranteed coverage for all. She was the founder and president of the Medicare Rights Center. More recently, she has founded Just Care USA, a website and newsletter providing helpful and trustworthy advice to older adults and care providers. She serves as senior advisor to Social Security Works on Medicare policy and sits on the board of the Center for Health and Democracy. Mark Dudzik is the national coordinator of the Labor Campaign for Single-Payer Healthcare. The Labor Campaign organizes and coordinates grassroots labor support for single-payer Medicare for all healthcare in America. The Labor Campaign believes healthcare is a human right and advocates for the labor movement to take a leading role in making it so, just as it did back in the 1960s when it was instrumental in winning Medicare for seniors in the first place. Welcome, all three of you. I'd like to begin by talking about the priorities and behaviors of corporate health insurers, including corporate Medicare Advantage plans. How do their priorities and behaviors affect patient care? Wendell, let's start with you. You know firsthand based on your work at Cigna.
There we go. Can you hear me now? Thanks very much, and thanks for bearing with me, y'all. I am in Tennessee. I think I have just passed Bucksnort, Tennessee, which is one of my favorite places, somewhere between Memphis and Nashville, heading toward Nashville on Interstate 40. It's my home state, and to get to your question, Linda, profits are always the top priority for these companies. I know from the 20 years I spent with Humana and Cigna, that is always top priority. And for insurers that are paid upfront for covering people's care, like Medicare Advantage, plans offered by small employers, that means that focusing their efforts on enrolling people who are healthy and minimizing the number of enrollees with costly needs. It's actually a very easy recipe for success, and these companies have figured out how to use that recipe. If they don't provide a lot of costly care, they can make out like bandits, and they are. As a sidebar, much like other countries, large employers don't pay insurers up front for their employees' care. Rather, they pay insurers only to administer the coverage and process claims, which is far more cost effective and limits insurers' profits. In Medicare Advantage, corporate profits are strong every year. That's because most people use relatively few healthcare services. Medicare Advantage plans can ensure that most of their members are healthy by marketing to healthy people and restricting their network so that people with complex conditions are less likely to join or want to stay in the plans if they do. They can also impose administrative and financial hurdles to make it harder for members who are sick to get care. So those members are more likely to leave. For Medicare Advantage plans, competition means designing plans that attract healthy people and keep people with costly conditions from enrolling or remaining in their health plans. And I know firsthand how that works. Several years ago, I was in Tennessee visiting my family, my parents. One of the people who came by while I was there was a friend of theirs from church who was an insurance company guy. He was an insurance agent. Turned out he had an exclusive deal with Humana, selling Humana's Medicare Advantage plans. And he told us, me in particular, he said that it's like shooting fish in a barrel. And what he meant by that was that he could determine who he wanted to reach out to, and always would look for people that he knew from church primarily. They were in a big church. And he would single out the younger and the healthier ones and tell them all about the advantages, and it's certainly obscuring some of the disadvantages of Medicare Advantage. So that's how they do it. They're very targeted with their enrollment and sales and marketing efforts. Right now, Medicare Advantage is where the biggest profits lie. Medicare Advantage is absolutely a gold mine. It is the gold mine for insurance companies these days. Insurers get paid a lot for what they deliver. This past year, they covered a lot less care than usual across the board, and they had their most profitable year ever during this pandemic. And that certainly is true for Medicare Advantage. It might come as somewhat of a surprise to a lot of folks, but insurance companies these days, including the biggest one, United Healthcare, are getting a majority of their revenues these days from government programs. United, just a week or so ago, announced its earnings for the fourth quarter of 2020 and full year 2020. And I looked at it and did the math and found out that they're getting now 2.5 times as much revenue from the government as they are from their so-called commercial payers, from individuals and from even their employer customers. So that just shows you how much money they are now getting from the government. And most of that money came from the Medicare Advantage program. To be clear, insurers are paid up front could not attempt to deliver high value care if they wanted to. That's because they couldn't profit if they did. If they offered plans that worked well for people with cancer and heart disease, for example, they would attract more members needing that kind of care, that kind of costly care, and they would need to raise their premiums higher than their competitors. So that's the way it is in private insurance as well as Medicare Advantage plans, which is, of course, private insurance. Healthy people looking to save money would opt for the lower premium coverage, and the insurers trying to do good would see their revenues fall dramatically. So you see, the system is flawed and makes that happen. Here are my words of caution to anyone who's listening. Even if your health plan is doing what you need it to do today, you have no guarantee of coverage when you need that care. Companies change all the time. Their leaders come and go. Insurance companies are bought and sold or leave markets where they're not profitable. I know that from my own parents' experience. And all of a sudden, the Medicare Advantage plan that seems to be working well can work poorly or exit a market, leaving their members scrambling to find a new plan. And that is a situation that my mother experienced. I did frankly encourage my parents to enroll in a Medicare Advantage plan when they were younger. The plan was sold, and ultimately United Healthcare bought it. When my mother needed skilled nursing care after breaking her hip, she needed to have some rehab services. We found out that the network that was available to her was extraordinarily paltry. There was no skilled nursing facility, no rehab that was available to her anywhere close to her home. So I went through, being her advocate, tried to see what I could do. The only real option for her to get the care that she needed in a nearby and good skilled nursing facility was for her to go back into traditional Medicare. So we were able to do that. She was not alone. A few years ago, I was interviewed by Kiplinger magazine because they had been picking up on this trend. And they found that happens a lot toward the end of a beneficiary's life as they need more expensive care. They're finding that the network of providers available to them is often very insufficient. So there is this trend, there has been for years, of Medicare Advantage enrollees opting to go back in traditional Medicare. It's not easy, and it can be very expensive because it's hard to get a Medicare supplement policy when you do that. But that is something that happens all the time. And it's so that, these beneficiaries can get the care that they need from the providers they want to see. And this is, of course, putting more of a burden on the traditional Medicare program, because as these beneficiaries leave the Medicare Advantage program, they're going in traditional Medicare when their care is the most expensive. So these companies have created something that is a real cash cow for them. So just to reiterate that, to underline that, it's all about the money. It's all about the profits.
Okay. Thank you, Wendell. Mark, employers and unions have had a role here, right? Can you talk about that?
Sure, Linda. Thanks for having me. This is it's a great opportunity to talk about these issues. So I was a local union president for over 20 years, and I can tell you that there was a time when most union employers provided high quality wraparound coverage to supplement traditional Medicare for all of their retirees and their spouses. And unions fought really hard to win and maintain quality health care for their retirees. And these benefits gradually spread to many non-union employers also. They often included full prescription drug coverage, dental care, and other coverages that Medicare didn't offer. By 1988, 66% of large employers provided retiree health care coverage. But by 2018, only 18% of large employers provided that kind of coverage anymore. So what happened? So retirees really were hit with this perfect storm when first legal decisions limited the ability of unions to negotiate on behalf of retirees. And then there were these new accounting rules in both the public and the private sectors that required employers to list the cost of future benefits as current liabilities. And then you had all of the kind of widespread plant closures, corporate bankruptcies, reorganizations, and offshoring that plagued the economy over the last 2 or 3 decades. And all of those factors just kind of disrupted the connections between workers and their former employers. The local business that hired you and provided your benefits was now owned by some corporation, maybe on a different continent, and was being traded and bought and sold all the time. And, those owners had no interest in maintaining those relationships with their former employees. And it was very difficult for workers to even engage with those employers under those circumstances. And these changes, this reduction in benefits, they just had devastating effects on real people. And I remember, in my local union, there's a guy named Paul G. And he was he's a real tough and proud union man, someone who fought hard over the years. And he was just reduced to tears in the union hall one day. He came in because Union Carbide had eliminated his retiree benefits while his wife was in the hospital dying of cancer. And he just could not understand how this could happen to him. They promised us we would be covered for life. It was in writing. We had these benefits for life. How can they do this to us? And, this has happened all over the country as those numbers went down. And so today, to the extent that employers are offering anything, they often just provide a very limited subsidy and a list of possible plans. And they basically are saying, here's a few bucks, go get your own health care. And under these conditions, cheap plans drive out quality plans because it's all about the dollars. And unions sometimes also steer retirees into Medicare Advantage plans because they appear to be more affordable. They offer additional benefits, and they often look very similar to the kinds of managed care plans that cover most active employees these days. Some union plans may also get some kind of an incentive or rebate from private insurers to entice them to encourage their members to sign up. So those are some of the factors that push unions into supporting Medicare Advantage plans. But the real problem, of course, is that these plans all promise a lot more than they deliver. Many people think that they're going to save money under the Medicare Advantage plan, and then they get sick and they find out that they can't get the health care they need without paying huge out-of-pocket costs, especially if they have to leave the narrow networks that are a key feature of these plans. And in most states, once you get out of traditional Medicare, it's hard to get back in because there is no requirement that insurers provide you with an affordable wraparound plan.
Thank you, Mark. And by affordable wraparound plan, that's like a Medigap plan, the kind of thing that Wendell was also talking about how it's difficult to get. Diane, as we have seen, many people have chosen Medicare Advantage over traditional Medicare. I myself am in a Medicare Advantage plan. Is that bad?
Well, it's bad on many levels, although at the moment, it's not always bad for the people joining. So you could be in luck, but let me explain. It's certainly bad for traditional Medicare. Medicare Advantage is a threat to traditional Medicare. As more people join Medicare Advantage, we're up to 40% now, as you mentioned, traditional Medicare becomes weaker, and the more likely it is that Congress will end traditional Medicare. So you won't have that out that Wendell was talking about that many people use when they get really sick. Medicare Advantage is also bad for national health spending and the Medicare Trust Fund because Medicare Advantage actually costs a lot more than traditional Medicare. As Wendell explained, we're paying these Medicare Advantage plans a lot of money. We're handing them a bucket of money to provide sometimes no coverage whatsoever to people or very little coverage. And on average, they get paid $1,000 more per person than people in traditional Medicare, than the government spends on people in traditional Medicare. So for people who need a lot of care, Medicare Advantage can be especially bad. Vulnerable older adults and people with disabilities are at the mercy of insurers who, for the most part, profit when they create obstacles that keep people from getting needed care. So what do? They create the obstacles. And there's no way to know when you choose a Medicare Advantage plan whether you'll face these obstacles. How the plan operates tomorrow may be very different from today, right? They're constantly changing. So they're really hard to regulate and oversee for that reason. And just to say it, for individuals who are healthy right now, Medicare Advantage is still a gamble. You're okay if you're healthy and you don't need much care, but if you get sick and need costly care, you might not be able to see the doctors and hospitals you want to see. Your health plan might not approve the care you need. Or if you happen to be visiting a friend or family member outside of your area, you might not have coverage outside that area. So the question becomes, is Medicare Advantage worth the risk or the gamble? Everyone has different risk tolerance, but people in poor health can face an array of problems. As I mentioned, they might not be able to see the doctors they want to see. Their doctors could leave the network and then force them to switch doctors mid-course of treatment. And even when they see in-network doctors, people in Medicare Advantage plans can have a lot of out-of-pocket costs. In 2021, out-of-pocket costs can be over $7,000 a year, deductibles and copays. That doesn't include prescription drugs. And then you can face delays and denials of care. And when you need care urgently, that can really compromise your health. And finally, as Wendell and Mark have talked about, when you switch back to traditional Medicare, you're going to need supplemental coverage, but you may not be able to get that coverage. It might be unaffordable and it might be unavailable. So over time, especially if traditional Medicare goes away, Medicare Advantage plans are likely to put more restrictions on care than they already have and cover even fewer services. They could easily go the way of chain nursing homes, taking a lot of the money from the government and running, keeping it for themselves and offering little to their members.
Diane, that's a scary prospect. I know that you advocate for a fully public, new and improved Medicare for all. Can you summarize the main differences between public and private insurance and why it matters?
Absolutely, yes. And Medicare for All, just to be very clear, advocates for Medicare for All, Congresswoman Pramila Jayapal's bill and Bernie Sanders' bill are talking about public health insurance like traditional Medicare, where the government pays the claims directly and sets the covered rules, where profits aren't a piece of the picture, where government technically assumes the risk, which means that it spends more money if people need more care. And at the same time, Medicare for All works just like traditional Medicare in that it covers care from almost any doctor anywhere in the country. There's one big open network. It covers care at centers of excellence. So, and it's accountable to the public and not to shareholders. Whereas Medicare Advantage is private insurance, like the plans in the health insurance exchanges also. These plans are accountable to their shareholders, and that usually means they prioritize profits. And because the government hands the insurers money up front to cover the full cost of people's care, the insurers profit more the less care they provide. So paying less for care and paying for less care becomes their priority, regardless of the consequences for the people they are insuring.
Thank you for that explanation. Wendell, we have stated in the title of this webinar that Medicare Advantage plans would sabotage our fight to get new and improved Medicare for all. What kinds of power do Medicare Advantage plans have them that allow them to be such obstacles?
Very important question, Linda. The companies that sell Medicare Advantage plans wield three types of power. One is political power, another is marketing power, and the third is coverage power. And these give them the ability to deceive people about the value of these plans. Let's start with political power. They have enormous influence over Congress and policymakers. They spend a ton of money on lobbying, and part of their successful lobbying strategy a few years ago was to establish something called the Better Medicare Alliance to influence public policymaking. The insurance industry hired a former Democratic Congresswoman, Allison Schwartz of Pennsylvania, who I know, who left Congress to run for governor. It didn't work out for her, so they hired her to run the Better Medicare Alliance, and she's still there. And these companies help members get elected through campaign contributions. And in turn, you could say that these companies essentially own these politicians. They also have marketing power. Medicare Advantage plans have the power to enroll a disproportionate number of healthy people, as we've said. They can market effectively and crowd out the public plan. It worries me a great deal, by the way, where that 40% of people enrolled in Medicare Advantage plans, that keeps inching up every year. And I think it's probably inevitable that in a few years, more than 50% of people will be in these plans unless we do something about it. And once Medicare Advantage plans is predominant, I think we'll see a further withering, can you say that? Diminishing of the traditional Medicare program. I'll take that out, take that way. So if they don't like coverage for care from a cancer center or a center of excellence, for example, it's not likely that people will, with cancer, will enroll. In other words, they probably will not have these centers of excellence that people, when they get sick, when they unfortunately are diagnosed with cancer, that they have access to. And since most people are healthy, they support the Medicare Advantage plans because they can say, these plans save money that way. And then there's coverage power. Medicare Advantage plans can determine the terms of coverage, who provides your care, and what is covered and when. And it bears repeating again, they have limited and often ever-changing networks of providers. The federal government is not watching over the services these companies cover or telling them their network doesn't have centers of excellence in it. These companies decide. That's why people in Medicare Advantage plans have been found to get lower quality home care than people in traditional Medicare. And that's why they can offer additional benefits that are low cost to keep members who are healthy relatively happy. So that's how this is like, again, shooting fish in a barrel. You can promise people when they're younger, say that we got gym memberships or discounts on this or that. It's appealing. And people don't really pay attention to the downsides or to how insufficient these provider networks can be for people who have chronic conditions, who really need costly care. That's how they garner support while profiting very handsomely.
Boy, that is power indeed, political and marketing power on top of the coverage power, especially that political power is really a problem. Mark, I have heard that some unions are actually pushing back against Medicare for All. You understand unions better than almost anyone. Why is this so, and how is Medicare Advantage responsible?
It's a great question, Linda. First, we need to understand that unlike most countries in the industrialized world, unions in the United States negotiate healthcare benefits for workers and retirees. Most of the rest of the world, healthcare is a right. It's not linked at all to employment. And many unions in the US have always supported this arrangement because they felt that they could use their bargaining power to get better benefits for their members and thus create a union advantage that would encourage other workers to join the union and increase the loyalty of the members, the existing members to the union. But, starting in the late 1980s, healthcare costs started rising 2, 3, 4 times faster than our wages. And they went up at this rate year after year after year. And this placed huge stresses on the whole system of employer-provided healthcare. And employers began to deal with the increased costs that they were facing by providing healthcare by shifting more and more of those costs onto the backs of workers, and by moving to so-called managed care plans where insurance bureaucrats now make the decisions about your healthcare that you and your doctor used to make, and then moving to plans that have very narrow networks, which makes it much harder for many people to get access to real quality care. And this crisis that developed over the years affected the most vulnerable. They were the first to suffer. Those with the least bargaining power, the least ability to defend themselves suffered the worst. And so many retirees either lost benefits altogether or they were forced onto lousy Medicare Advantage plans. And these Medicare Advantage plans crowd out traditional Medicare wraparound plans because they are so much less expensive and they appear to offer the kind of benefits that many workers are used to. And because most retirees are healthy when they sign up for the plans, they often don't appreciate the problems with Medicare Advantage. In fact, these plans make their money by marketing to healthy retirees and finding ways to dump them when they get sick. I had a friend who kind of embarrassedly told me that she had just signed up for a Medicare Advantage plan because it gave her a free gym membership. And I said, of course they did. They're looking to sell these plans to people who are healthy enough to want to go to the gym every day. Wait until you're older and sicker and you can't even go to the doctor that you want to see. And this is sort of dynamic, this kind of sales strategy that these plans often follow. So more and more unions and union members now are seeing that the time has come to take healthcare off the bargaining table by making it a right for everyone in America. And the experience of this pandemic, where we're looking at 1 million workers a week losing their jobs and having their access to healthcare disrupted because of that. And that's been happening every week since last March. And this has convinced many more union members of the value of moving to a Medicare for all system. They see the injustice of a system where when you lose your job, you lose your healthcare. And another reason unions have been very reluctant to support traditional Medicare and Medicare Advantage for all is that traditional Medicare no longer appears to be as good as private insurance. It has no out-of-pocket cap and doesn't offer additional benefits. So the plan that was set up in 1965, has suffered considerable erosion over the years. One of the unions that we work with very closely is the American Postal Workers Union. And Mark Dimenstein, the president of that union, always says that if you want to privatize a public good, the first thing you have to do is to undermine it. In the Postal Service, that means undermining and degrading that service, and it frustrates postal customers, which sets the stage for privatization. The same thing has happened with Medicare. So you don't put caps on out-of-pockets. You don't add additional services and benefits that people need. And then you give the folks the option of leaving the public plan and buying into a private plan that gives them the illusion of wraparound coverage while enriching a bunch of healthcare profiteers. What we really need is an improved traditional Medicare program for current recipients so that unions and all Americans see the benefit of expanding it to everyone. Improving Medicare means that current recipients would no longer have to make the tough choices between private Medicare Advantage plans and private Medicare wraparound coverage that they would currently need with traditional Medicare. They would then see that it is in their interest to join the fight for expanded and improved Medicare for all.
A very strong statement, Mark. Thank you very much. Diane, what's your take on why Medicare Advantage plans are such an obstacle to Medicare for all?
There are a range of reasons, Linda. One big issue is that many Americans no longer see government as a force of good, so they don't see the enormous value of Medicare for all. And the government is not out there marketing the virtues of Medicare for all. But as we've noted, the Medicare Advantage plans do a very good job of marketing themselves. So people see them in a positive light. And people are misled into believing that choice of private insurers, which Medicare Advantage offers, gives them greater protections. But that's a myth. Wendell's written a lot about this. Choice of insurance lacks any value, though, when insurers benefit from offering low-cost care and denying care. Getting choice just means you have a choice of poor options. It doesn't mean you're getting anything good. So think about it. You're told to choose the health plan that's right for you. And that says it all. It suggests correctly that you could choose a health plan that's wrong for you. And why should that be possible? That's risk, not choice. That's not a healthcare system that values healthcare as a right. Medicare for All works for everyone because it lets everyone make the choices they want to make about the care they get, when they get it, where they get it. They can see virtually any doctor and have full coverage without worry about the cost. It's far more cost effective. But the health insurance industry and its allies are good at confusing people. They're suggesting, in some Kafkaesque kind of way, that Medicare Advantage is public insurance calling for Medicare Advantage for all. It's Orwellian. Advocates for public insurance want to guarantee people reliable health care. And you can only do that if the government pays for care directly and sets the coverage rules. It's only with government insurance that you have guaranteed health care, not only tomorrow, but over the next several years from the government. Whereas with private insurance, next year you might be forced to switch to a new insurer. Next month you might be. The health insurance industry is succeeding because, as Wendell explained, it's great at deceptive marketing. It's succeeding because of its political power. It's succeeding because of its power to deny people with complex needs care and to give healthy people gym memberships to keep them happy. Since most people are healthy at any given time, the 80-20 rule applies. Satisfaction polls suggest people with Medicare Advantage are happy. But the real question is, what do people who are experiencing serious health conditions feeling about their health plans? And that we don't know. Keep in mind that insurers are changing all the time. Their leaders change, their owners change, their behaviors change. The bigger they are, the more they charge. The less likely they are to do right by patients, the less accountable they are.
Mm-hmm. Diane, what steps could we be taking?
Well, sadly, we're not getting Medicare for all in the next couple of years, but here's what steps we can take now. We need Congress and the public to understand that Medicare Advantage is not cost effective and doesn't offer individuals the high value care they need or they could need at some time down the road. Medicare Advantage plans shouldn't be able to profit from denying care. They should not be able to arbitrarily restrict access to care. Congress needs to eliminate overpayments to Medicare Advantage. We're paying them $1,000 more per member than we're spending in traditional Medicare. And that's eating into the Medicare Trust Fund and its solvency. We need to urge Congress to require that Medicare Advantage plans are publicly accountable. What care are they not covering that they should be covering? What are their denial rates? What are their mortality rates? One paper came out recently suggesting that thousands of people die each year because they picked the wrong Medicare Advantage plans, but we don't know which ones those are. So people can't know which ones are better and which ones are less good. Medicare Advantage plans should be required to share all their data. After all, they're paid with taxpayer dollars. And at the same time that we're correcting some of the most egregious issues with Medicare Advantage, we need to be strengthening traditional Medicare and putting it on a level playing field with Medicare Advantage. And that means, at a minimum, we need to improve traditional Medicare and give it an out-of-pocket cap and prescription drug coverage, as well as really dental, hearing, and vision care. So those are just a few of the things that we need to be advocating for now to set the stage for Medicare for all down the road.
Okay. Thank you, Diane. And thank you, Wendell and Mark. I'm going to pause right now to let our audience know we have time to take a few questions from those of you who signed up for this webinar via Zoom. I invite you to submit your questions. Use the chat function, and I see a lot of people have been using it, but if you could refrain from using it to just say hi to your friends and all of that, and just use it to maybe note down a very brief question. And we have somebody who is monitoring that. We won't get to all your questions because there's many of them, but hopefully we'll get to some representative ones. Diane, in the meantime, though, while we're waiting for audience members to submit their questions, I'll ask one myself. You spoke about the need to improve traditional Medicare, as well as changing Medicare Advantage plans and holding them more accountable. It does seem to me that changing or improving traditional Medicare would get us closer to the new and improved Medicare for All envisioned by Representative Jayapal and Senator Sanders, and would help steer us away from a future Medicare Advantage for All. Could you expand a little bit on those improvements to traditional Medicare that could set us down the road to having a true new and improved Medicare for All?
Sure, I'll just take a couple of minutes to say that right now, the fact that you can't enroll in traditional Medicare without having supplemental coverage, because if you do, you assume so much financial risk. Since Medicare has no out-of-pocket cap, and that makes it very hard for a lot of people to sign up for traditional Medicare. And that's why they go to Medicare Advantage. It's not that most people want to have a restricted choice of doctors. It's that traditional Medicare is just incredibly expensive. And what the data show, the Commonwealth Fund recently did a report, is that if the government actually capped traditional Medicare at around $3,500 out of pocket, it would cost maybe $35 a month, either to the government or to the person with Medicare, depending upon how it was designed. And it would give people the protection from financial risk that they need to be in traditional Medicare. I think on the flip side, Medicare Advantage out-of-pocket costs are extraordinarily high at more than $7,000 a year. I think people don't think about that. But if you get sick in December and have costly needs, you can be out of pocket $14,000 between December and January. Mm-hmm. And the government doesn't explain that to people. I couldn't even find it in the Medicare handbook. And I'm not sure how many people appreciate that. So we need an out-of-pocket cap in traditional Medicare so that people can feel comfortable signing up without worrying about paying an exorbitant amount for supplemental coverage. We need to make sure that people understand the risks of Medicare Advantage.
Mm-hmm. Thank you. It seems to me that it's a shame that Americans are put in this position of having to make these choices in the first place.
Yes.
At this point, I want to turn to Mike Andrew. Mike is PSARA's executive director, and he's been monitoring the questions coming in. I should have told people on the chat function not to be too wordy here and not to say hi to your friends, but just to ask the questions. So, Mike, have you been able to sort through any of them? Do you have some questions for our panelists?
Yeah, thank you, Linda, and thank you to everybody who did post questions. Since we're a little bit limited for time, I've tried to combine questions that have similar themes. So let's start with this one. What are one or two policy changes we could advocate for in Congress or with the Biden administration that would help reduce the destructive impact of Medicare Advantage? And who wants to start? Maybe Diane, start on this one?
Well, let me kick it over to Wendell since I just answered Linda's question.
Okay. Wendell, what are a couple policy changes we could advocate for that would help limit the destructive impact of Medicare Advantage?
Well, really to make Medicare on a more of an even playing field with Medicare Advantage plans, there needs to be a cap on out-of-pockets at the very least, limiting people's out-of-pocket exposure, which, as Diane and we've all mentioned, it can be extraordinarily expensive under the traditional Medicare program if you get sick or injured and need expensive care and you don't have a Medicare supplement policy. So there needs to be a cap. But also the companies themselves that offer Medicare Advantage plans need to be held far more accountable. The Medicare program also needs to have richer benefits. We've noted that in Medicare Advantage plans reel people in by promising discounts on gym memberships. We don't necessarily need that, but we do need to have a dental benefit and hearing aids and other benefits that have been proposed, and Congress should consider to enrich the benefits. When we talk about Medicare for all, by the way, we're talking about improved Medicare for all, to improve the basic traditional program, to again make it less likely that these Medicare Advantage plans can be as successful as they are.
Okay, thank you, Wendell. Diane or Mark, did you want to add anything to this?
I think Wendell pegged it.
Okay.
I would add one thing if I could, which is that we should take a page, learn lessons from large employers. Large employers do not hand over a pot of money to an insurance company and say, do with it as you see fit in covering our employees. They are smarter than that. They say, here's what we want you to cover, and here's how it's going to get done. And they pay their insurers to process claims and to administer them. And that is far more cost effective, and it gives them control over the quality of care when they're big employers who have an interest in doing that, that their employees receive. And there's absolutely no reason why the government shouldn't be doing the same thing with Medicare Advantage plans. Instead of giving them an incentive to deny care, they should be paying them to administer the insurance, and they should be overseeing what they're doing. And anything less than that is a recipe for giving them reason to inappropriately delay and deny care. And as we know from a recent Office of the Inspector General report, it has found that there is widespread inappropriate delays and denials of care in Medicare Advantage.
Okay, thank you. Here's a related question on strategy. Do the panelists think it's wiser to push for Medicare for all in Congress, or to focus on state or regional Medicare for all programs?
I'll take a little bit of shot at that.
Go ahead, Mark.
The answer is yes. I think, look, we need to have a national Medicare for all system. It works best if everybody's in everywhere, and it works best at a national level. But there is a transition period of how we go about winning this. We're taking on the biggest, most powerful business in the history of capitalism, and we have a huge fight ahead of us. And one possible way forward is to win some breakthroughs in states that are large enough and wealthy enough to sustain a publicly funded universal health care system, and to use that as a way to reignite a national movement for Medicare for all. So, our organization supports viable efforts that have significant labor support to build state-based universal publicly funded healthcare systems while we're fighting the long battle to win Medicare for all nationally.
Thank you, Mark. Do the other panelists have something to add? Okay, here's another question about strategy, and it's about the role of state insurance commissioners. I live in Washington State. We have a very progressive and active insurance commissioner here. The question is, could we push state insurance commissioners to set better standards or more transparent standards for marketing?
I'll take a crack at that. I was actually at one point a consumer representative at the National Association of Insurance Commissioners, and there are some great insurance commissioners. But what I want to flag for everyone is before the Affordable Care Act was passed, very few states had any consumer protections for people when it came to health insurance. As Wendell mentioned, the health insurers have so much power that they're able to keep the states from doing right by consumers, and they're able to wield just tremendous power. So I don't think there's much hope for getting states to do right by consumers when it comes to health insurance. There are a few that have some power, but they have to have the skill, they have to have the will, they have to have the power, they have to have the money to fend off the insurers. And I don't even know if there's a single state that has that. I hope there are a few and that we could get single payer in a state, but it's harder than you could ever imagine.
Yeah,
It is.
I
I would add to that. I followed Diane's lead and also was a consumer rep to the NAIC. The first meeting I went to just gives you an idea of the power of the industry. There are maybe a dozen of us who are consumer reps at any given time. We were completely overwhelmed at that first meeting. I saw that there were about 1,000 industry representatives, and these are meetings you probably never even heard of. They existed, but the insurance commissioners convene about 3 times a year as a group, and the insurance industry is there in force. Keep an eye on them and to influence what they do and say, and the same way when they're back home. And there's no insurance department that is adequately resourced.
Yeah, look, the insurance industry is an antisocial business model. I mean, it makes money by denying care to people. So, we can regulate the hell out of it, but, you can't change that reality about it. And the other thing that happens is if you have a state that is aggressively trying to regulate that business, the business has a opportunity to just leave the state. And that has happened in other regulatory situations. They'll just walk away and go somewhere else where they're not as heavily regulated. So, as long as you treat healthcare as a business and a commodity and use that model of treatment, those folks are in the catbird seat, and they will exercise the power that they have to control people's access to healthcare.
Okay, thank you. Here's another question for the panelists. Where would someone go for an honest and objective evaluation of healthcare plans? I mean, if you can't trust Joe Namath, who can you trust?
I'll start.
Go ahead,
but we on this panel could not tell you which health plan is better than another health plan.
Exactly.
The information is not available. That's why it really is a gamble. I noticed in the chats that people were talking about Kaiser, and there's no question that a nonprofit Medicare Advantage plan is going to be or should be better in many ways than a for-profit plan, because they're not putting profits first, but still they have to compete with the for-profits. And that means they have to be careful about how much care they pay for, because if they're paying for every sick person in the community and a competitor plan is paying only for healthy people, then they can't survive, even if they don't have to make a profit. It just becomes not financially sound for them to operate. So that's the nature of the beast. We can't. What happens in Europe, I should flag, is that there are private insurers, but they operate in the same way as I was explaining. Insurers operate with large employers. The insurers are basically told what to do by a government. And that's a system that's different from the Medicare for All that we're all supporting, but at least it's one in which the insurer can't just, run off with the money.
Okay, thank you. I think we have time for one last question, and this is an interesting one. Do insurance companies pay taxes on the income they get from selling policies? And if so, wouldn't the government lose necessary revenue if people didn't buy their plans?
Well, I'll start. Yes, insurance companies that are for profit do pay some taxes, there's no doubt, but they are really taking advantage of us taxpayers. So when I said earlier that United Healthcare now gets 2.5 times the amount of revenue from government programs as from the commercial side, that means we as taxpayers are supporting these companies, enriching them, and they take money that we spend as taxpayers to reward their executives and their shareholders. So I think the government would do much better if it didn't have to provide this additional corporate welfare to these insurance companies to offer Medicare Advantage plans.
Any other panelists want to add something? Okay, thank you then. Linda, back to you.
Thank you, Mike. Thank you, audience members. And a big thank you to Diane Archer, Wendell Potter, and Mark Dudzik. You have given us so much to think about as we work toward a just, affordable, and universal healthcare system driven by the needs of people rather than profits. So thank you again. This webinar has been brought to you by Puget Sound Advocates for Retirement Action, or PSARA. We are a multi-generational advocacy organization working for a secure and healthy future, not just for current retirees, but for future retirees, our children, our grandchildren, and all future generations. We fight for a future characterized not only by economic justice and health justice, but for racial justice and environmental justice, and a world that is neither flooded nor parched and burning. Thank you for being here today, and please consider joining PSARA. Thank you.